President Biden expected to sign a $2.5 trillion increase in the nation's debt ceiling after the House approved the measure early this morning. Today's the day, by the way, the Treasury Secretary Janet Yellen had pinpointed for a possible government default if Congress hadn't acted. Join us now to talk about this, inflation, and much more. Senator Ted Cruz of Texas. Senator, it's good to have you on this morning. Good morning.
Good morning. Good to be with you.
This, well, the debt ceiling is one thing, but it seems more, I don't know, with maintenance. Everybody, does play that card now and again. But I'm more interested in what happens with the big social spending bill and those inflation numbers that we saw. And Republicans are talking about how that's going to be inflationary, and we see the White House arguing it's not going to be inflationary and would actually help. So I don't know if we'll get anywhere on that, but it hasn't passed yet. What do you attribute the 9.8% PPI increase, which was the hottest in decades, and then the previous week where we saw the CPI, both hot? This is all happening way before the Build Back Better bill has even, we're still arguing about it, don't even know if it's going to pass. And we already have the inflation.
Right. Now, look, that's exactly right. Inflation is raging across the country. The November numbers have inflation at 6.8%. That's the highest inflation this country's seen since 1982, nearly 40 years ago. And it's, at the end of the day, it is not complicated. When you spend trillions of dollars you don't have, when you print money, when you borrow trillions of dollars, when you expand the money supply, you drive up inflation. That cause and effect has been true from the dawn of time. It's true now. And, you mentioned the debt ceiling the Senate voted on yesterday, the House voted on early this morning. The current debt is $28.9 trillion. Today, Joe Biden is preparing to sign a bill raising that by $2.5 trillion. $2.5 trillion, Joe, is the largest increase in the debt ceiling in the history of our country. It is unprecedented. $2.5 trillion with a stroke of a pen, and that doesn't pay for a penny of the Bernie Sanders socialist budget, what they call Build Back Better, what more and more Americans are calling Build Back Broke. It is trillions more, somewhere between $3, $4, $5 trillion on top of the $2.5 trillion, on top of the $28.9 trillion. The inflation fire is raging, and the Democrats' solution, sadly, is just to pour gasoline on it. They want more of what's causing inflation, and if they succeed with that, we're going to get a whole lot more inflation, which is hurting the most vulnerable among us, particularly seniors. Seniors get hammered with inflation, and this White House doesn't seem to care.
Senator, we have people complain. We have the Republicans come on, talk about this spending bill. Democrats come on and will immediately point out the Trump tax cuts, which weren't, in their view, the Democrats would say, weren't paid for, didn't pay for themselves. Tax cuts for the rich, you're okay voting for that and increasing the deficit since it wasn't paid for your rich buddies and corporations. But now we're trying to do get some child care and tax credits, things like that for families, and you're against that. How would you explain that you are for one and totally against this one?
Well, sure. One's good for the economy, one's terrible for the economy. It's actually, you're right. You're repeating the talking points back that the Democrats tell you. If you look at the 2017 tax cut, that tax cut was focused on jobs. It was focused on reducing tax cuts on job creators. And the purpose of it was to create more jobs, to drive up wages, to bring manufacturing back to America. And it worked extraordinarily well. We saw by 2019, we had the lowest rate of unemployment in 40 years. We had the lowest rate of African-American unemployment ever recorded, the lowest rate of Hispanic unemployment ever recorded. We had median wages rising. We had poverty dropping. It succeeded. And by the way, their line that it wasn't paid for, when we cut taxes in 2017, the next year, federal tax revenue went up. And the next year, federal tax revenue went up. And it went up every year after that. So it generated more revenue because of growth and economic productivity and more jobs. Contrast that with the Build Back Broke. There's actually a big tax cut in Build Back Broke. but it's a tax cut for Democratic donors. It's a tax cut for millionaires and billionaires in big blue states, because one of the most expensive part of the bill is they repeal the cap on deducting state and local taxes. Now, contrast the two. The 2017 tax cuts focused on job creators, more jobs for working men and women. The Democrats repealing the SALT deduction doesn't create a single job, but I'll tell you what it does. It pays off the rich Democratic donors in blue states, number one. And number two, it encourages local politicians to raise taxes more. The Democrats are not fighting for working men and women. They're not fighting for the senior citizen who's on Social Security, who's got a fixed budget, who with inflation now is seeing the cost of food going through the roof, is seeing the cost of gasoline go through the roof, the cost of houses and cars and mortgages and rent, all of that going through the roof. Giving a tax giveaway to billionaires who are Democratic donors doesn't benefit them at all, but it's what the Democratic priority is. They take care of their buddies in government, and they don't fight for working men and women. We ought to be focused on working men and women, which means we ought to be bringing jobs back. This bill, the Bernie Sanders socialist budget, destroys jobs because the Democrats' approach to this is higher taxes, higher regulations on job creators, and then they wonder, they scratch their heads and they're confused why the jobs go away.
Senator, switching gears just quickly to mandates, vaccines. This isn't the latest poll, but it's pretty representative. It's split down party lines for mandates, and you got 3/4 of Democrats are overwhelmingly for mandates, and much lower percentage of Republicans, just one in four of Republicans, and 6% are adamantly against. What about being a Republican versus being a Democrat causes this dichotomy between, or the divide between what we should do in terms of trying to take on the pandemic?
You know, it's a great question, and I think in a time of crisis, character is revealed. And on the Democratic side, in this time of crisis, we've seen that Democratic politicians are authoritarians. They will control your life, they will order you to obey, and they will destroy you if you don't. Let's take the state of New York. Just this week, sadly, the Supreme Court did not take a case, an emergency appeal out of New York of doctors and nurses, frontline medical workers who'd been heroically fighting this pandemic from the beginning. And they're now facing a vaccine mandate, and these doctors and nurses are choosing not to take the vaccine for religious reasons, and they're facing an order to be fired. Number one, they're going to be fired. And number two, the New York government, in really a punitive, vindictive way, is saying we're going to fire you and you're ineligible for unemployment. So we are just going to punish you. And I got to say that is wrong. My view on vaccines are simple. I'm pro-vaccine. I've been vaccinated. My family's been vaccinated. I encourage people to get vaccinated, particularly if you're in a vulnerable population, whether very elderly or you have diabetes, you're overweight. I think being vaccinated makes sense. But I also believe in individual liberty, individual responsibility. Joe, it's your business to make medical decisions in your life, and no government petty tyrant has the right to order you to undergo a medical procedure. And Joe Biden and the Democrats are perfectly comfortable saying it doesn't matter if you're a young woman and you want to have children and you're concerned that the science may be unclear on the impact on fertility. That's one of the groups that we're seeing declining to get vaccinated are young women who want to get pregnant. These politicians say they don't give a damn. Either obey, comply, or you're fired. And as I travel the country, literally every day, there hasn't been a day that I'm not stopped by soldiers, sailors, airmen, and Marines, that I'm not stopped by airline pilots and flight attendants or doctors or nurses or firefighters or cops who come up and they say, thank you for fighting against this vaccine mandate. Let's take Chicago. The Chicago Police Union says that upwards of 1/3 of Chicago police officers are refusing to comply with the vaccine mandate. Joe Biden was asked what should be done about it. He said, fire them. Fire 1/3 of the cops in Chicago. By the way, he said the same thing about firefighters in New York City. Listen, I'm proud to stand with the Chicago Police Union. I'm proud to stand with the New York Firefighters Union. And these vaccines are wrong. The government has no business ordering you to make health care choices. That ought to be a choice for you and your doctor, and you should weigh the costs and benefits for your life and your health.
Senator, I guess the other argument is that, okay, if you are unvaccinated and you do have a much worse outcome in terms of, being hospitalized in intensive care, that there's other people with life-threatening conditions that don't have a bed. Our healthcare system gets overwhelmed, so it's not just the individual that we're talking about here. And I guess we hear we're all in this together. We hear that a lot. And, if we all pull together and all get vaccinated, then the hospital beds aren't taken. People that need elective surgery on a heart valve or take your pick, chemo, all those things get delayed when the hospitals are overrun. It could happen again, theoretically, with Omicron.
Well, listen, if you want to encourage people to get vaccinated, that's great. But you don't have the right to force them, to order them to get vaccinated. And you know what? If you're concerned about shortages in hospitals, then maybe tell the governor of New York to stop firing doctors and nurses. One of the most asinine things we're seeing is thousands of doctors and nurses being fired. And so New York is now canceling elective surgeries. Why? Not because of this flood of unvaccinated in the hospitals, but because they fired doctors and nurses and have shortages. In airlines, we're seeing rolling delays, one after the other, because they have shortages of pilots and crews, and they have shortages of air traffic controllers. These policies make no sense. And by the way, when they get challenged in court, we've seen plaintiffs go in and challenge. Biden has 4 vaccine mandates, one for active duty military, one for federal civilian employees, one for federal contractors, and one for private employers with 100 or more employees. When these get challenged in court, over and over again, the courts are striking them down, concluding that they're illegal, they're unconstitutional, they exceed the authority of the federal government. And the Biden White House doesn't care. When the Federal Court of Appeals struck down the private employer vaccine mandate, or stated, and the next day, the Biden deputy press secretary said, well, obey it anyway. Never mind that court order. You should obey the decree from the White House. That is just lawless. And we live in a country with rule of law, not just the ability of government leaders to make diktats that the people are forced to obey.
Senator, to the point that Joe was making about just trying to be in this together to the extent we can and trying to keep hospital beds open rather than full, I'm curious how you think about it in this context. I think you are for drunk driving laws. I think. We restrict people from drunk driving, not because every driver on the street is going to kill somebody, but they might. And I would ask if that's actually a similar analogy in some way, because that's sort of what we're trying to do. Vaccines unto themselves are not going to necessarily prevent every death and every transmission, but they're going to reduce it substantially. And that's why we have laws like that on the roads.
Look, there's no doubt, and there are questions of cost and benefits. Drunk driving kills tens of thousands of people every year. It imposes an enormous cost. And it is plainly unsafe. If you contrast it here, and listen, when it comes to vaccines generally, I mean, we require vaccines for children in schools for other diseases, but there's a difference. When you're dealing with measles or mumps or polio, those vaccines have been around decades. We've seen what the health consequences are. We've had the ability to test them, not just test them over 12 months, but test them over generations, and we understand they're medically safe. But when it comes to the COVID vaccine, I'm incredibly grateful we have these vaccines. I think Operation Warp Speed under the Trump administration, where they streamlined the red tape and they moved forward on an incredibly accelerated pace to develop these vaccines, I think that was extraordinary, and I'm glad for it. But saying that you're glad for the vaccines doesn't mean you have to have the fervor of a religious zealot to say the vaccines are perfect and there are no risks and anyone who questions them is a heretic. There's still a lot we don't know. And so I think it is reasonable for people to engage in cost-benefit analysis. So, for example, both my parents are in their 80s. I urged my parents to get the vaccines. They're both vaccinated. My father didn't want to. I had to argue with him for a month to get it. He chose to get it ultimately. I said, at your age, it doesn't make sense to take this risk. I had the same analysis in my life. So did Heidi, my wife. But you know what? For kids that are 8 and 10 and 12 years old, there are a whole lot of parents that are saying the risk of COVID for a young child is relatively low. The rate of fatality for children is incredibly low. And given the unknowns, the uncertainty of an experimental drug approved or experimental vaccine approved in an incredibly rushed circumstance, there are parents who are reasonably making the judgment, let's wait and see what the long-term effects of this vaccine are before we give it to our young children. That is a reasonable decision that government shouldn't make for you. You ought to be the one to make it. Talk to your doctor, do research, read the studies, but government doesn't have a right to just force you to obey. And sadly, we're seeing Democrats, whether it's mayors, whether it's governors, or whether it's President Joe Biden, that believe they have the power to control your life.
All right, Senator, we've got to run. We appreciate your time today and all your viewpoints. Hope to see you again soon. Thanks.
Look forward to it. Thank you.